Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, December 22nd, and I just thought I would come to a support group meeting a couple of days before the holidays just to see how people are doing. Because, when you're going through the holidays, sometimes things start to flare, right? Yes, they do, between the stress of traveling and shopping and family expectations. Hi Barbara, hi Donna. I accidentally disconnected my main keyboard about, about just as I was trying to start the support group meeting 15 minutes ago, and it's a whole hullabaloo when that happens. So hello Andrea, it's nice to see you. Hello Sarah, Merry Christmas to you. Hope you guys are feeling like you're in the Christmas spirit just a little bit today. Hope you got some nice music playing in the background. So this is not a regularly scheduled support group meeting, but you know what? I just thought, what the heck? What the heck? You know what? This is the hardest time of the year for some patients. Why not see if we can help a little bit today? Right? Because you just never know. You never know. Someone out there might be struggling. You may not be, may not to know what to do for the holidays and all that sort of good stuff. Hello, Wendy. Merry Christmas to you. Sarah says, "Hey, I'm just recovering from your Botox." Oh, Sarah, when did you have that? You have that on Thursday or Friday? I don't know. I don't know how many people will get today. It doesn't matter. It doesn't matter. Thank you. Well, it's been a few times I wear red, but I do have a little Christmas shirt on. So there you go. Thank you. Thank you, hun. I appreciate that. I don't know. I always associate red with the color of anger. And so it's really rare that I ever wear red unless it's a holiday. Thank you, Danielle. Merry Christmas to you too. Brian says, "How long does Bladder Builder take to work?" You know what? You got to understand that nothing happens overnight in the bladder. It is physiologically impossible for the bladder to repair anything in 24 hours. And in fact, a new study came along. Now, this was really interesting. I read it, I think, last week, and it was part of a video that I shared on Twitter. And it was a video on chronic UTI. And one of the factoids in this video is that when you look at the structure of the bladder wall, there are about 4 to 5 layers of cells and the urothelium. Let me show you. Let me show you. Because, when we're just getting such good insight, about how basic things work. And there's so much about the bladder we don't know yet, right? So here is a three-dimensional picture of the bladder wall, right? Okay, so you got on the top of it, you've got a nice thick coating of mucus, and then you got 4 to 5 layers of cells, and then underneath that you've got blood vessels and nerves and all that sort of stuff, and mast cells. So this new study found that it takes 100 days, 100 days for one of the bottom cells to migrate to the top. Now, I remember I attended a National Institutes of Health IC conference years ago. There's a Dr. Anthony Schaefer who works in the Chicago area, and he gave a lecture where he talked about bladder healing. And the way he explained it is that um, underneath one of these large cells is a group of stem cells. So imagine an extra large pizza and a little tiny pea, right? A little tiny pea. So when that extra large pizza is damaged, it takes that little tiny pea, that little tiny stem cell, a minimum of 2 weeks to at least change shape and size to fit in there. Okay, now that was like 20 years ago. Now, this new presentation that I watched suggested instead that these cells migrate from the bottom to the top and that it takes 100 days. 100 days. So, getting back to your question, Brian, how long does it take for the bladder to heal? The answer is going to be 100 days potentially for good cells to reach the top. And we see with every treatment, we've always known that you got to take something at least 3 months to really have a good chance for something to help. And given that 100-day interval, that makes sense. Um, so, if we're talking about tissue repair, and bladder repair, you got to remember no supplement is going to heal the bladder. Only the bladder can heal the bladder. Your job is to create an environment that will support healing. And that means we've got to not pour acid on the wounds in the bladder. If you're IC subtype 1, subtype 2, it means that we're working on muscle relaxation. If your muscles are tight and squeezing your bladder, reducing blood flow to your bladder. It means, keeping your stress level down, which is why the holidays are so hard because, hello, it's the most stressful time of the year, right? It gets rough out there. It gets rough out there. And it's all rainy and stormy here in California, so all my lighting is weird. If you could see out my window, it's very dark. So I hope that that helps, hon. I hope that I mean that at least helps us understand why you've got to take something like 3 months, and depending upon what it's going to do. So what would Bladder Builder do? Just like what Elmeron would do, is put a protective coating on the top of the bladder to protect those cells so they're not injured or damaged by anything irritating in your urine. It would also protect the blood vessels and the nerves underneath so that they're not being provoked by whatever is in your urine. We call it in IC research, in the IC research world, just kind of so you know, there's two different types of research that are being done. One is called basic bladder studies. And the purpose of a basic bladder study is to help us understand how this crazy, wonderful organ works. And I say it's wonderful for a reason because the bladder is the only organ in the human body designed to hold toxic waste, right? Because urine is body waste. Urine contains ammonia and urea and all sorts of stuff. So how can a healthy bladder hold irritating stuff for hours at a time and not get damaged? That's a miracle of the bladder, is that it can hold all of your body waste, and hopefully that body waste won't irritate you and cause any damage until you're able to pee it out. And the way that it does that is through this nice thick coating of mucus. It's a really nice thick, your bladder's like your mouth. It's a hollow organ covered with mucus. And so the thicker the mucus, the stronger your bladder. Unfortunately, mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus. When you're older and you have less estrogen, like this girl, you have less mucus. So your bladder's ability to defend itself is changed. It's a bit compromised. And that's why some women find that in their 30s and 40s, they might be able to get away with a cup of coffee in the morning. But all of a sudden, when they're in their 50s or 60s, they can't do it anymore. And that's not a disease process, that's aging, right? That's aging. Merry Christmas, everybody who just came in. Hello. Oh, so Sarah had your Botox 2 weeks ago and you're still recovering? Wow. What are you recovering from? Hi, Carol. Nice to see you. Hi, Carolyn. Hello, Sonia. Buon Natale. Hello, Gina. Hi, Gigi. Hi, Cindy. Cindy says, I was wrong about Canada having cystostat. My doctor didn't inform me that he was changing. Yeah. Well, you never know at this point in time. It's not like the pharmaceutical companies tell us anything, right, Cindy? So don't worry about it, hon. It just is what it is. Hello, Sonia. Hello, and Merry Christmas, Jill. It's always nice to meet another Jill. I always think we Jills, we tend to be a bit on the rare side, right? All right, so let me introduce myself. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I am the longest serving IC support group leader in the United States, 27 years and counting, 28 years. Is that right? Did I get that right? Yeah, I'm right. 27 years and counting. Whew. um, almost the longest serving international support group leader too, but not quite. Getting there, but not quite. My purpose in doing this meeting is to make you so strong, so knowledgeable, so informed that no one can mess with you again, right? That no one in your family or your friends or your doctor can be able to, well, should be able to tell you that this is all in your head and have you believe it, because it's not true. It is not true, my friends. IC is real, it is treatable, and there are many variations of IC. Not all of you are the same. For some of you, IC begins in childhood. For others, IC can begin after menopause. For many guys, IC begins after a car accident or a fall or riding a motorcycle for a long period of time. Or, God forbid, you were a paratrooper in the Army and jumping out of a plane and falling on your hips over and over and over again, falling on your pelvis. And so, what I would like to do is give you some much needed, and the wrong kind of word for it is ammunition, but education and knowledge, so that as you are sitting at your holiday table, and somebody says, "So, Jill, what's up with your bladder? How come you're not better?" And you get to explain, well, number one, it's really not my bladder. It turns out I have a pelvic injury, and we think it started when I had a baby or when I fell or when whatever. We're going to fill in the blanks here. And you get to be our ambassador for the IC movement. You get to be um, the spokesperson to your family because, I mean, I'll tell you one thing that's just so interesting is whenever I go out and talk about IC, I find other people with IC every single time. I was out my mother was having a medical procedure on Friday. Yeah, Friday. And it turned out the nurse that was caring for her, a lovely, lovely guy, we got to talking and we were talking about the holidays. And I was saying, you know what, man, I'm a home girl. I do not like to travel on the holidays. And he goes, me too. And I'm like, and we're just kind of talking. I was like, I really, you're not going to find me traveling any long distance, a long period of time, because when I do, I get uncomfortable and I tend to have to find a restroom. And he goes, he kind of looks at me, goes, uh, me too. And we're going on and on and on our discussion. And he's saying, I have this. I go, yeah, me too. And he goes, I have this. It's like, yeah, me too. It was absolutely hysterical, and in the end, guess what? He had IC and IBS just like I have IC and IBS. Mine is extremely controlled, his is extremely controlled. The challenge is that stress tends to exacerbate it for both of us. And that's why we're here today, because if you're feeling stressed out with the holidays, I want to try to help you. So how are you feeling, guys? Monica says, "Does giving birth make IC worse? I just had my baby. My IC pain has gotten so bad." Well, number one, when you give birth, you're going to traumatize your pelvic floor, and if you're IC subtype 3 pelvic floor driven, yeah, absolutely, absolutely, your muscles have just taken a beating. And what's interesting is the United States is one of the few countries that does not send women who have just had children to pelvic floor therapy. And that would be one of the very first things I would do is I don't know how long you have to wait, 6 weeks, 2 months, is get yourself in and have a proper pelvic floor assessment, and let's see what's going on with your pelvic floor. That would be number 1. And number 2, your hormones are gonna change a bit, although normally, since you're breastfeeding, hopefully you're breastfeeding, Monica, your estrogen levels continue to stay remarkably high, so you shouldn't be having any hormone driven flare. If you're not breastfeeding, if you're bottle feeding, then your estrogen levels might drop. And if there is and I could be completely wrong about hormone levels there. Um, but that's the way I interpret it off the top of my head. Okay, but you might, don't quote me on that part. Google it. Google it first about what happens to estrogen levels after you have your baby. Okay, but that's my guess. My guess would be that would be what it is. So, okay, so you're in a flare, and so this is the time for you to be calming and soothing to your body, right? I need you to be calming and soothing to your body. Follow the IC diet, drink plenty of hot water, hot milk. If you want to do a very, very diluted juice, like a diluted apple juice with maybe a little bit of cinnamon in it, something like that for the holidays, that would be great. But given the fact that your IC is worse, and this stands for everybody, guys, this is not the time to chow down on mom's lasagna on Christmas Eve because you might ruin your Christmas day. You got to make really good, smart decisions so that you can really, really enjoy your holidays, especially if you're IC subtype 1, Hunter's lesions, IC subtype 2, bladder wall driven. Monica, the critical question here is, when is your pain the worst? Before you pee or after you're done peeing? If your pain is worse before you pee as your bladder's filling up with urine, then that points us to the bladder wall. And then that does give us one other thing that we have to think about. And that is there any chance you could have picked up a urinary tract infection after having a baby? Absolutely possible. A lot of stuff going on down there, a lot of bacteria getting moved around down there when you're having a baby. And so if you have a fever, if your pain has gotten suddenly worse rather than better, always important to call your OBGYN, let them know, and see if they can do a quick urinalysis for you. Okay. We have a pregnancy resource center on our website you might find helpful too. If you go over to icnetwork.org, go under self help, you'll find a pregnancy resource center where we've got a couple of journals of IC patients who've had babies. Guys, IC patients have babies all the time. We make great moms. You're going to make a great mom. Do not be afraid of having a baby for those of you who are thinking about having children. And for those of you who have just had children, like Monica, yes, for the short term, there's going to be challenges, but for the long term, you've just welcomed a wonderful member to your family. And what a wonderful holiday gift that is. And I'm so happy for you and I'm so proud of you. Be strong, ask for help when you need it. If you want to talk, you're welcome to give me a phone call. I'm more than happy to see if I can give you some ideas too. Gigi, my eye doctor is sending me to a specialist to test me to see if I have my early signs of macular degeneration are due to Elmeron or age related. How good. That's very, very good, Gigi. I'm really, really glad you're doing that. Brian down on YouTube. You guys, so if I'm looking up here, I'm looking at Facebook. If I'm looking down here, I'm looking at YouTube. Okay. So Brian on YouTube says he had stopped taking Elmeron after hearing the horror stories. I think that honest, I mean, listen, I'm not a doctor. I cannot give you medical advice. I can only speak from the perspective of being extremely educated about IC, but also being a patient myself. Brian, I think that was absolutely the right decision. Now that we have our first case study showing that eye disease or eye damage from Elmeron appears to worsen even after you stop the medication, I think that you made the right decision. And that is exactly the decision I would have made. Merry Christmas, Lelena. Nice to see you. Hey, am I matching or what? I got a snowflake on my top and I got a snowflake on my thing. Drinking some peach tranquility herbal tea. So good. Sarah is explaining that she just got out of her Botox. She had Botox 2 weeks ago, and she has a long recovery from her Botox. Sarah, I actually haven't heard of patients having quite as long a recovery as you, but you know us, we tend to be wickedly sensitive, and I'm one of them. So you might be sensitive to various medications, anesthesia, anything at all like that. I know that when I had my laparotomy, I had so you guys, I was diagnosed with IC in 1992, and I spent that first year in terrible pain, absolutely terrible pain. No pain medicine, nothing. And my bladder pain started after a chemical accident in a swimming pool where I swam and swallowed massive levels of acid in a pool that had been improperly treated. Literally woke up that night with what I thought was the world's worst bladder infection. Turned out to be chemical cystitis. And I called the pool the next day. I said, "Hey, is anything weird going on with the pool?" The pool manager goes, "Why?" And I said, "I swam yesterday and he immediately stopped me and he went, "You swam?" I was like, "Yeah, a bunch of us swam." He goes, "Wasn't the close sign up?" Like, "No." Because we bombed the pool. No one was supposed to swim for 48 hours. I would have been blinded if I hadn't had my goggles on. So anyway, my first diagnosis that week was chemical cystitis. And uh I didn't understood I did not get it. Ironic given the fact that I have two chemistry degrees is like, what I was thinking, I still in my brain was thinking disease. I was not thinking injury. And so I was drinking a quart of cranberry juice a day for a year, yada, 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 doing all the wrong things, just like so many of you. It's a giant learning curve here. And the pain was so bad, I was absolutely convinced that I was dying of cancer, and I demanded exploratory surgery. I did not believe them when they said you got interstitial cystitis or chemocystitis. And so Sarah, my long story here is I remember it took a long time for me to recover from that procedure. Like I had dizzy spells for like 6 weeks afterwards. So and chemocystitis, ironically, is not as rare as you might think it is. Any patient going through chemotherapy is subject to chemocystitis, where the chemicals of the chemotherapy can damage the bladder wall. We also know that various medications can do that, like ketamine. And you would think I would have been able to sue, right? Because it irreversibly changed my life, and I have permanent nerve damage down there because of this chemical exposure. I couldn't sue because we didn't have the research backing it up at the time until last year, 26 years later, when the Center for Disease Control finally released their chemical safety data. And it turns out has happened to thousands of people, not just me. And unfortunately, statute of limitations, way gone, way gone for me. And the pool actually burned down in the fires 2 years ago, and the club is no longer in existence. So it is what it is. Carolyn says, if I have pelvic floor, my bladder was okay after test. Should I use bladder builder? I'm also using topical estrogen. Hun, it's entirely your choice. I mean, you got to understand that if you are struggling with estrogen atrophy, as many of us are for women, your this coating is thinner than normal. It just is. Your body can't produce as much mucus without the estrogen. And so having an extra chemical barrier is often useful, especially as women get older. And so that would be the only reason why I would take a supplement if your bladder is okay and it appears to be your pelvic floor. But if you've got some estrogen atrophy, then using a supplement like Bladder Builder, Rest, Sister Renew, and hey, guess what, guys? Sister Protect is supposed to arrive tomorrow in our warehouse. I just got the bill for $18,000, so I better be there. Like, holy hell, I never in my life thought I would be writing such big checks. Who knew? So for those of you who like Sister Protect, I should have it soon. It's basically been off the market for 9 months due to a cancer warning. They had an ingredient in it that has now been linked, an ingredient in the capsule itself that was linked to lung cancer if you breathed it in. If you swallowed it, it's considered by the FDA to be safe. However, nobody in their right mind is going to take a supplement that says warning cancer and reproductive harm. So that warning is now gone. That ingredient is now gone, and we will have Sister Protect back in stock. But I'm just going to go on the record right here and say Bladder Builder, in my opinion, is a much better supplement, and Bladder Rest too. All right, Chris. Hello, Chris. When will the medical establishment officially accept my condition as a variation of IC? It depends upon the education level of the physician. Now, Chris, you and I are both a part of Kaiser Permanente. And so, what we know about Kaiser Permanente is that they do have pelvic pain specialists in San Francisco. I'm located in Sonoma County in Northern California. And we know that a critical part of their pelvic pain program is pelvic floor physical therapy for patients who have tight muscles. I was working with one of the pelvic pain specialists last summer because of vulvodynia, and I was immediately sent into pelvic floor physical therapy. She absolutely nailed the fact that my irritation down there was due to tight muscles. So they acknowledge it. They might not call it a subtype, but they absolutely diagnose it, acknowledge it, and treat it. Subtyping is new. You guys, really, it's only at the upper echelon, the international researchers, the international doctors who are using the words phenotyping and subtyping. The local clinicians really don't know that much about it yet. They will though. I mean, they know the variants, and they're now asking more about the variants, but they might not use the word subtype 3 or they might not use the word pelvic floor dysfunction. But if they've done any reading at all, they should be testing for tight pelvic floor muscles at a minimum. Jill says, does Botox help with pelvic pain? If the pelvic pain is coming from tight pelvic floor muscles, yeah, because the Botox would relax the nerve, which would then relax the muscle. And so there's a chance that it could. Um, there are a number of clinicians around the world who have used Botox for Hunner's lesions. Um, you have to understand that we've got symptom management versus disease in anatomy. So the real question has to be, will it help a symptom or will it help heal a Hunner's lesion? And there's no evidence that Botox could heal a Hunner's lesion. And there are extremely strong conflicting opinions about using Botox for lesions. In fact, there was a really amazing, kind of somewhat shocking educational moment at an American Urology Association conference a couple of years ago with a urologist from Eastern Europe who presented a study in which he claimed that Botox was was the best way to treat Hunner's lesions, and yet when you looked at his data, he had virtually no success. And the top IC researcher in Europe came up to the microphone and slammed him like he's never been slammed before and basically said, "Well, sir, how do you treat Hunner's lesions?" He goes, "With Botox." The young researcher said, "With Botox." He goes, "You mean you've never tried laser therapy? You've never tried a steroid injection? You've never tried any of the lesion-specific therapies that we know can dramatically reduce the symptoms of IC?" And he went, "No." And this elderly statesman in the IC community said, "Well, maybe you better start doing that." So, not particularly popular to use Botox, nor considered effective, at least I'm having a wiggling of a memory. Sometime in the last 3 to 4 months, there might have been a new study that might have given better results, but for the most part, I'm not aware of that. Hello, Karen. Hi, Libby. Hello, Christine. Hi, Maureen. I'm not sure why what I'm on is helping, but it is. I normally have to get installations every 2 weeks. Haven't had one done since October. You started on Plexus and wow. I didn't know what those are. What is Plexus? Is it a supplement? One of my keyboards here is broken, and so I'm on a small keyboard that only has 17% um, power right now. So cross your fingers. Plexus. It's a slimming product. Egads. Healthy gut, happy. Well, okay, healthy gut. That's interesting. Hold on, let me look. Oh, they have a whole bunch of different products. Microbiome activating, hunger control, you know what? There's a lot of products here. I don't have any evidence that these are particularly helpful for IC in any way, shape, or form. I don't know what WoW is. You'll have to explain. When I think of WoW, I think of World of Warcraft, which is a game I used to play. Libby says, all of my hormones completely changed after my son was born 2.5 years ago. I've been on hormone replacement therapy for testosterone and estrogen since January, and that alone cut my pelvic pain in half. Awesome. Awesome. The whole hormone influence on bladder health is they're still trying to understand all the ins and outs of it. Monica says, your pain is worse after urination for sure. Then that points to your muscles, son. Hi, Jana. Libby says, I do not understand why my body stopped making these hormones, especially the testosterone. I don't know, hun. I have no clue. I have no clue at all. Hi, Jana. Amy says, mine is bladder wall. My bladder was injured during my hysterectomy. Oh my God. Amy, I'm so sorry. In our latest magazine, and here, hold on, where is it? So so the IC network has a patient magazine that goes to doctors' offices and patients around the country. It's called the IC Optimist. Whoops. If you've never seen this before. And the lead article on this is one that I wrote that talks about confusable conditions. What are the conditions that can mimic the symptoms of IC that you need to rule out, right? And so anyway, there's like 40, I've listed 40 different ones: chemical injury from food, urinary retention, bladder stones, yada, 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 fibroid tumors, chronic infection, estrogen atrophy. The last one, Amy, the last one, I don't know if you can see this, bladder wall perforation, which is usually occurs during some sort of surgery. How are you doing now, hon? Has it gotten better at all? Hi, Alan. Nice to see you. Amy, how long ago was your hysterectomy? And can you explain a little bit about what happened to your bladder? Was it sliced open? Did they have to stitch it together? Was it a big injury or small injury? And how long ago was it? I'd love to hear more about that. Christine says, my IC was in remission during pregnancy and returned a few months after delivery. That's absolutely common. Hi, Faith. Hi, Deborah. Allison, is hormone imbalance a real thing? Oh God, yeah, absolutely. This is why patients will flare, at different times during their menstrual cycle. Your bladder is directly influenced by various hormone levels. So when your estrogen levels are high, you got a lot of nice thick coating in your bladder. Your body's able to produce a lot of mucus because of that higher estrogen level. When your estrogen levels drop, your body cannot produce as much mucus, so your bladder is going to be much more vulnerable. And so your bladder responds intricately to very, very, I mean, your bladder responds to intricate, minute changes in hormone levels. And hormone imbalance is absolutely a real thing for many women. It sucks. Libby says chemical cystitis. Oh my God, that must be what my mom has because of chemo. Oh God, yeah, absolutely. Kathy says, what is bladder builder? Let me show you. Bladder builder. Let me get these down for you. Okay. Alrighty then. So let's see. How do I want to say this? One of the great frustrations for any IC patient out there is the lack of affordable therapies. And the great reality here, the great, and Amy, hold back. I'm going to get back to that eye thing, but let me just answer this question first. The great reality is that there are very few therapies for quote unquote IC that are considered safe. This last 2 years has been devastating for the IC world because our number one oral approved medication for IC in the United States, Elmeron, has now been linked to permanent eye damage, what appears to be permanent and progressive eye damage. I hate saying that. Oh my God. Amy, I'm giving you a big giant hug right now, right from me right now, because she's got that right now. And then the other oral medications, specifically the antispasmodics, also known as anticholinergic medications like Detrol and Ditropan, have now been linked to dementia. So we're at a real crossroads here in the IC world where we need safe therapies that will be calming and soothing to potential to the bladder and other parts of the body. And patients are having to choose, am I going to risk hair loss or eye damage, or am I going to risk dementia? Terrible, terrible choice. Terrible choice. Well, what you may not know is that more than 20 years ago, um, uh, supplementation became possible in the ICU world. And we have a real history of supplements going back over time that many patients have used quite successfully, and some that have been backed by research studies. So the first supplement, actually, the first supplement that was introduced was a supplement called CystaQ. And CystaQ was, again, about 20 years ago. The Q stands for quercetin. And it turned out the CEO of Far Laboratories at the time was struggling with prostatitis. And he decided to try to help with prostate issues and did really formative research at UCLA, which proved that quercetin had an antihistaminic effect. And so he created a supplement called ProstaQ and a supplement called CystaQ. And CystaQ is still available in Canada. It's still available, not the top supplement now, but they paved the way. Good solid research studies at UCLA led by Dr. Dan Shoskis, okay, who's now very big in the ICU world. The second supplement that came along again about 20 years ago is a supplement called Desert Harvest Aloe. And what do they say? Necessity is the mother of invention. Well, this product was developed by two sisters, one of whom had IC and who found aloe to be uniquely helpful. And they started a company and they did a double blind placebo controlled study at the University of Oklahoma that proved that aloe can be calming and soothing to IC symptoms and bladder symptoms in general. Now, it was a small study of about 10 people. And so the size of the study kind of reduces its credibility a wee bit, but it was still a double blind placebo controlled study. And there are many patients out there right now who use aloe. And the aloe that we recommend is aloe from Desert Harvest Aloe. Um, Unfortunately, and what does aloe do? It's just calming and soothing. It's really calming and soothing. And this company has a pretty wide and diverse product line now that you can find at desertharvest.com. Unfortunately, quite a few people are aloe intolerant. I'm one of them. And aloe gives you runs or gas or stomach distress, something like that. So then, 17, 18 years ago, one of the top IC researchers in the world, Dr. Theoharides at Tufts University, he was now Dr. Theo is a lovely, lovely man, and big federally funded IC researcher at the time. And I say this because I am a geek. He is a geek. He is the geekiest of geeks when it comes to IC and therapies. And he's a pharmacologist, MD, who teaches at the Tufts School of Medicine and a big researcher, right? So the university, or no, the state of Massachusetts asked him to do a study on the safety of over the counter supplements. And he was doing that and reading all the data. And he got an idea. He goes, you know what? We don't really have new things coming up for IC. I wonder if this could help IC patients. And he felt so strongly about what he learned that he decided to try to make a supplement. And he made the first name for the supplement was Algonaut. Within a year, he changed it to Cystoprotec. Cystoprotec has two methods of action. It has quercetin in it for the antihistaminic effect, just like CystaQ, but he was the first one to put a bladder coating in it, chondroitin and hyaluronate. These are two ingredients that are believed to coat the bladder. They're actually used as therapies in Europe and Canada, where they actually instill either chondroitin or hyaluronate or them together directly into the bladder. And so he was the first to put it in a supplement. And then he backed it up with a really large research study of over 250 patients who took it, I think, for 6 months or a year, and showed that 57 to 58% of patients using Cysto Protect did better. And in that original study that was published in the Canadian Journal of Urology, the patients who had the most severe IC actually did the best with Cysto Protect. So Cysto Protect absolutely dominated the market for 15 years. Absolutely. But then, we started learning more about IC, and we started learning about nerves and how nerves in many of us become irritated and sensitive. And in fact, at the European Society for the Study of IC meeting a couple weeks ago in Europe, they described IC as a sensory disorder, a neurologically driven sensory disorder, which I happen to believe is very, very true. I mean, that's very, very true. Nerve function in the bladder plays a critical role in this. So, the thought of how do we calm nerves down is important and relevant, right? And Dr. Theo, when he created Cysto Protect, they eventually sold the US licensing rights off for Cysto Protect to another company called Alavan. And part of that was a non compete agreement. So he could not create his next generation supplement. But another doctor did, and that was Dr. Gio Espinosa. And so about 5 years ago, Dr. Gio, who's the head of New York University's Integrative Urology Department, and he comes into our live chats frequently. I can't scroll down. For all I know, he could be here now. Go to drgeo.com. That's drgeo.com and sign up for that doctor's email. He has great blogs, especially guys. Alan, any guys in here? Sign it up because he really specializes in prostatitis. So anyway, here, let me get a drink here. Anyway, because Dr. Theo couldn't, Dr. Geo decided that he would try to create a next generation supplement. And this one does four things. So it has four methods of action. So it's got the quercetin for the antihistaminic effect, it's got the chondroitin for the bladder coating effect, it's got um, aloe vera for the soothing effect of the aloe, for those of you who are aloe tolerant. And his way of tackling that neuroinflammation was with an herb called lemon balm. Lemon balm is known so it's not lemon, it's a mint with a lemony scent, that it's known for having a bit of a sedative effect, but also a nerve calming effect. And so he introduced this about 5 years ago, and it received a really good review. A lot of patients who were using Cysto Protect switched to Cysto Renew and felt it was a better formula. And then there's always a group of people who like the original formula. So Cysto Renew was the next generation formula for the last 5 years until Bladder Builder and Bladder Rest were launched earlier this year. So Bladder Builder was the result of a here, sorry, the light shining on it, if you can see that. And it's actually 120 capsules, not 150, so ignore that. Bladder Builder is has many more methods of action. It is a really, really robust formula. So it has the quercetin for the antihistaminic effect. It's got the chondroitin and the hyaluronate for the coating effect, and it's got the glucosamine too. Although we don't really know what glucosamine does for the bladder, it's not considered that important, but it is what it is. It's got probiotics in it. It's the first formula to work on the biome and to try to help the gut biome. It's got collagen for the bladder wall. But the most important ingredient in this one that makes it truly revolutionary is the fact that it contains PEA, palmitoethanolamide, PEA. And here it is. So PEA is something that has been studied in Europe for more than a decade with pain. And I knew about it 10 years ago. It was just too expensive. It would cost thousands of dollars for one prescription to bring it to the United States. Um, but it has been studied with a wide variety of pain conditions, anywhere from fibromyalgia to burning mouse syndrome to sciatica. And all of those studies are really solid, good studies, showing high success, especially for neurologically driven pain. Ironically, the team that put this together, which I was a member along with the top IC researcher in the United States, what we didn't know is that the Europeans, the Italians at the time, were actually finishing up a study of PEA with IC, which was remarkably successful. That was presented last May at the American Urology Association. And it was a combination of PEA and resveratrol, and what it found was at month 3, 87% of IC patients taking it had a significant reduction in their pain. At month 6, every patient taking it had a significant reduction of their pain, and 25% were pain-free. So, Bladder Builder has PEA in it for the pain fighting effect, and that's what makes this focus both on the health of the bladder wall, the health of the gut, but also to have an actual pain reducing ingredient in it. Now, of course, there's no way that I can say any of these are going to work for you. We're also freakily sensitive, but you have a choice between taking a medication which could damage your eyes or cause dementia versus taking something like a supplement, which is considered to have fewer side effects, is important. Combine that with the fact that the American Urology Association guidelines for IC, which is a 6-step treatment protocol, lists supplements as a step 1 treatment option. And in general, they want you to try supplements before you try medications with more side effects. So even the typical institution of IC researchers and guideline makers believe that supplements are viable. Okay, so Bladder Builder has more side effects, but then when the Italian study came out, we thought I actually pitched it to them. I said, "Guys, let's try to create a formula very similar to the study." And that is Peora. And Peora is just PEA and resveratrol. There's no bladder support ingredients in it. So if you're one of those patients where you like you like aloe or you like Sister Renew, but you would like to try to help some of your pain, you can just do the Peora instead. And what's cool about it is that it's only $29. It's literally the cheapest supplement out there I see patients use other than pre-leaf. And then of course, the year started with a bang with these new supplements that patients could try. And then the blank hit the fan when the new bottles of Sister Protect came out with the cancer warning that I talked about earlier. And so, as an option for that, since we couldn't do Sister Protect, that same company created Bladder Rest, which mimics the formula of Sister Protect but has more of the essential ingredients, and it's $10 cheaper. So, oh, so you've got options. I mean, the point here is you've at least got options. And I was thinking about this as I was taking a shower this morning. It was just like, my first year with IC was agony because I had no pain care, none. And the blessing that I had is after 2 or 3 days in the emergency room, I go back every morning because the pain was so bad. They finally gave me pain medication. And that's what finally gave me some relief because I was pretty desperate at that point in time. And to think that that's being denied patients now, that you can be in a wicked flare and you not have access to pain medicine is, in my opinion, cruel. And so to have something like this, which in a research study was found to reduce the pain of IC, and is to me important. It's just important. I'm not here to sell you anything. I don't wanna sell you anything. My job is to give you options, to educate you. I don't want you suffering in silence at home alone. I want you to know that there is hope. There's hope in subtyping. If you're one of those patients where you spent 30 years trying therapies and nothing's freaking working for you, we know why. Now we know that there are variations of IC, like the patient, Sue, who's been in here multiple times and she's talked about her story. 30 years worth of IC therapies, nothing worked. They finally do an MRI. And guess what? It was her pelvic floor, a big mass of scar tissue in her pelvic floor that she's now dealing with, right? And so your job as the patient is to solve your unique mystery. You are an anatomical mystery to be solved. Your job is to focus first on your anatomy. Is there anything in your pelvis that could be triggering your symptoms? It doesn't, because remember, the bladder and the bowel are linked through nerves. You could have bowel irritation that could be triggering the bladder. You could have bladder irritation that could be triggering the bowel. You could have a Tarlov cyst coming off of your spinal cord at L4, L5, triggering both of those nerves. So we got to get that Tarlov cyst fixed. Or, or if you're a woman, you could have a fibroid tumor or endometriosis pushing on your bladder. We got to get that checked out. Or if your symptoms began after some sort of traumatic injury like a fall, even though you're having bladder symptoms and you're going, it must be my bladder, it must be my prostate. My friends, I'm here to tell you that your pelvic floor muscles can trigger all of those symptoms, all of those symptoms. And that is why now every good IC clinic should be doing a pelvic floor assessment at your very first appointment. And that is why some patients don't respond to Elmoron or bladder medications because their symptoms are not with their bladder. Their underlying fundamental problem is with their pelvic floor. I had a hydrodistension 2 years ago when I had my hysterectomy, and guess what? My bladder's completely normal. Completely normal. When we walked in, when I had my post-op follow-up, my doctor was like, Jill, this proves once and for all your bladder is perfectly healthy. It is your nervous system and your muscles that are driving your symptoms. Hi, Rochelle. So this is about you embarking on a journey. You are the detective and you are the lead detective. You are the boss. They are not the boss. You are the boss. You pay your doctor. They don't pay you. And when you go to the doctor, what do I say? Never, ever, ever, ever walk in and say, I have IC. Never do that. Walk in and say, doctor, this is my symptom. I am here to have you help me understand what in my pelvis could be triggering this symptom. Is it my bladder? Is it my pelvic floor? Is it my nerves? If you have pain on the left side consistently, then that really points us to what the hell is going on on that left side, because that is not in general bladder wall irritation. That usually points to something else going on your left side, like um, you could have a Hunter's lesion on your left side, although patients don't really perceive lesions to that degree. It's more likely that you're going to have a muscle knot, a trigger point, something else weird going on the left side, or endometriosis, or something else. So when you walk into that doctor's office and say, I am here to understand the mystery, what is going on in my pelvis that could be triggering this symptom? And your ability to describe your symptoms is going to determine how successful you are. You cannot be one of those people who says, it hurts down there. Oh, for God's sake, please don't do that. Be specific. Is the pain internal? Is it external? Is it on the left side? Is it on the right side? Is it low in your belly? Is it high in your belly? Does it get better or worse when you stand? What makes it better? What makes it worse? What triggers it? And I want you to pay attention to the nuance, the weird little freaky symptom that happens once in a blue moon, because sometimes it's that little nuance that actually confirms the diagnosis. Like, for example, a fluttering feeling. One of the Facebook groups, and somebody was talking about this over the in the last couple of days, because I went through my news feed where somebody was describing fluttering at night. And anytime you have fluttering, we're really going to look either at a bladder spasm or we're going to look at a pudendal nerve entrapment. I have fluttering in my left butt cheek on the inside of my sit bone. So, like imagine the middle of your butt cheek and go about an inch towards your crotch. Whenever I sit too long, I get a pulsing fluttering right there, which is a nerve entrapment from sitting too long. Okay. All right. So I need to go back to Amy here for a moment here. So, man, how is that, Kathy? How is that as an answer for your question? And let me just close this up. So, you're an anatomical mystery to be solved. The next step then is what can be done to try to help that and physiological challenge or that physiological dysfunction. And some supplements have the potential to do that. If you've got chemocystitis and you've got profoundly irritated bladder, then desert harvest aloe might be helpful, or something with a coating might be helpful, right? All right. Woo! We are on a roll. I'm on a roll today. Like my jaw hurts because I'm talking so much. Okay. Let me just work out the kinks in my neck here. Amy, getting back to her hysterectomy, 18 years ago, her bladder was severely damaged with a tear. I still have as much pain today as I did then. Holy hell, Amy. Is it nerve pain? Is it electrical pain? Nikki says, is it possible to have estrogen atrophy at a young age? And at what age is lack of estrogen typically seen? I wasn't exactly sure why I was treated for it. Okay. It depends to a good part on heredity and genetics. There are some women who enter early perimenopause in their 30s. And then there are some women who just their hormones are not normal. They're just not normal, and they have never been normal. Women who haven't had a period, or their period is only once every 3 to 4 months. That's a sign that we've got some hormonal dysfunction happening. Or God forbid you've had endometriosis and they put you on Lupron, something which puts you in an artificial perimenopause or an artificial menopause, at which point in time, if you're 22, 23, you've got hot flashes because they're stopping all of your hormones. Hey, is anybody making a cookie today? Come on, it's the Sunday before Christmas. I stayed up till 4 in the morning last Tuesday. I made 12 loaves of Christmas bread, and then I did like 4 different batches of cookies that I had to get them all in the mail to family on Wednesday. It is crazy. Here, guys, hold on one sec. I got to go find something. I'll be right back. Bio break. Anybody need to run to the bathroom? Go now. You got a minute. I'll be right back. Alrighty then, I'm back. sorry. You know what? I worked out yesterday. I worked out yesterday, and oh man, whenever I do that, whenever whenever I work out, it's like I totally ding my SI joint. So I'm all stiff and irritated right now. All right. Okay. Are you back? Cindy says, "Hey, I'm doing okay without Sister Project. Bladder Builder's working. Yeah, baby. I love it." Well, you know, Gigi, he's the guy who developed the system that we use. She wrote, "I wish Dr. Payne had known about subtyping when I saw him a number of years back." Remember, there's a lot of research that's been done every year. The IC research is just gets better and better and better. And he's the one who pulled all the pieces together to create his phenotyping system. He calls it phenotyping rather than subtyping. I chose to use the word subtyping because I thought that was easier for people to understand. Gigi says, "This year I'm going to work on pinpointing my root cause and work with a naturopath." Go for it, girl. Go for it. Nikki, okay, so Nikki, who asked a question about is it possible to have estrogen atrophy at a young age? So Nikki's 21 and they gave her estrogen. You know what, hun? When I had vulvodynia in high school, because it turns out that I'm IC subtype 5, that I've inherited this more sensitive nervous system anyway. And they gave me estrogen back then too, you know? So it's kind of the like the standard go-to. The question really is going to be is how do you feel with it? But Nikki, more so, you know, hun, you got to remember that there are very clear variations in the IC world and the IC patient community. All you got to do is spend time in any support group, and you see patients. Some patients again report it beginning in childhood. Others report it after going through a rape. For some women, it begins after having a baby. For some men, it begins after falling on their tailbone, and for women, it can begin after falling on a tailbone. You so While all of us have been diagnosed with IC, we're not the same. And so the key to figuring out the right therapeutic approach is to figure out first what variation or subtype you might have. So let's do that. Let me get my slides. So let me just say here that up until 2008, pretty much everybody believed that IC was a quote unquote incurable bladder disease, right? But in 2008, something amazing happened. In 2008, we had our first clinical trial run by the US government that proved that pelvic floor physical therapy was remarkably successful at reducing the symptoms of a bladder disease. Which then, of course, had us all going, wait a second, how would muscle work heal a bladder? And the answer is, well, maybe some patients don't really have a bladder issue. Maybe some people have muscle issues. And in fact, if you go back 100 years and you look at all the descriptions of IC, what you see in medical journals, what you see are doctors consistently talking about tight muscles so tight they resemble piano strings. And yet they never put it together, right? They never put it together. They in their brain they were focused bladder, 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 bladder. And it was a physical therapist, Ronna Cotarinos, who 20 plus years ago, or no, not 20 plus, but 15 years ago, first started going to IC meetings and saying, guys, I'm helping patients doing physical therapy. And they blew her off. And when they finally gave her a opportunity to speak to the group, they gave her the last session at this big federal IC meeting that I went to, and most of the audience walked out. They didn't believe muscles were real. She now teaches them. Her theories were proven successful through the National Institutes of Health. So in 2008, the IC world changed. And it was at that point in time that everybody went, uh-oh, wait a second, maybe muscles are part of the problem. And so, and then in that time, since 2008, so what's 12 years later, we've learned even more. Now we have research that's talked about nerves and how nerves can be involved and heredity and all that other stuff. And so now, for the last 10 years or so, researchers around the world, clinicians around the world are trying to define the variations of IC. A one treatment fits all approach does not work. And the reason why it does not work is because we have many variations or subsets in this patient community. So I use a subtyping system or phenotyping system that was created by Dr. Christopher Payne, who ran the IC research program at Stanford University. And I'm just going to go through these quickly because we go through this almost every time, and you can learn a lot more about this over on our website in our subtyping section. Okay. Everybody in the world agrees that patients with Hunner's lesions represent a unique patient population. This is 5 to 10% of the patient population. Why? Because when we look in their bladder, they've got big red wounds that bleed. And when we biopsy those, they are filled with inflammation. All the other subtypes don't have the inflammation that Hunner's lesion has. And so, based upon the pathology results alone, pretty much everybody in the world in the IC community believes that Hunner's lesions is its own unique disease. And here's the other thing we know: lesion specific therapies work. Elmeron does not work with a Hunner's lesion. Supplements would not work with a Hunner's lesion. What works with a Hunner's lesion is injecting a steroid into the lesion or lasering the lesion or hyperbaric oxygen therapy or Lyris. So if you've got Hunner's lesions, there is a drive to separate Hunner's lesions from the IC community to create your own research group, and I completely support that. Also, just know that in Europe, if you're diagnosed with Hunner's lesions, you are diagnosed with IC. If you're diagnosed with any of the other subtypes, you're called bladder pain syndrome. In the United States, we merge both words together, IC bladder pain syndrome. Okay, IC subtype 2 is bladder wall driven. So these are the patients who have a legitimate bladder issue, that something has happened to their bladder wall. It could be chemotherapy, chemocystitis. It could be chemical injury from ketamine, or like I had from those crazy pool chemicals, which triggered my bladder pain for the first time. It could be estrogen atrophy. Because of the loss of estrogen, your bladder becomes more vulnerable. So that falls into this variant. And it could be an infection, could be a chronic fungal infection, a chronic a bacterial infection, or even a viral infection. So if you have pain as your bladder fills with urine that is relieved by urination, that is the bladder. That tells us that your bladder wall is being provoked in some way. The most common cause of bladder wall irritation is diet. If you are a diet soda drinker, you only drink soda all day, you only drink coffee all day, you got to understand that the human body and the human bladder was never designed for that level of acid tolerance and exposure. Your body was designed for life thousands of years ago. And thousands of years ago, the only acid in our daily lives came from unripe fruit once a year. We didn't have acid every day, all day. And eventually, high levels of acid are going to cause issues. In my chemistry degree, in my first chemistry degree, which was a fantastic degree, I really loved it because it was all lab driven. We all had to wear goggles and we learned really good basic safety. And you know that if you spilled sulfuric acid on your hand, it would at least turn red, right? And if I kept pouring sulfuric acid on my hand, it would get redder and redder. It would eventually create a wound. And if I kept foolishly doing that, it would never heal and it would get worse. Now, citric acid that is found in soda is certainly not as strong as sulfuric acid, but over time it's going to take a toll. And so what's going to happen is it's going to slowly start to erode this nice protective coating. And a lot of that has to do with ancestry too, especially if you're Northern European, because we didn't have a lot of acid in our daily environment genetically and from an evolutionary standpoint, we don't have a lot, we don't necessarily have the defenses for high levels of acid compared to somebody whose heredity is around the equator where you had a lot more fruit in your daily life thousands of years ago. Okay? So, if you have pain as your bladder fills with urine that is relieved by urination, that points to the bladder wall, and your therapies are going to be focused on calming and soothing the bladder wall. And that's where diet modification is critical because, hello, if you keep pouring acid on the wound, it's never going to heal. It's never going to heal. And what do we know now is that it takes 100 days for some of these important cells of the bladder wall to migrate to the top. Man, you're going to have to be on that diet months and months and months to really give your bladder an opportunity to repair itself. Think of IC as, don't think of IC as disease, because in your brain, you're going to go, I'm not going to let this disease rob me of something I love. And you're going to justify having that coffee or that soda. Think of it more as injury. And then you would ask yourself, hey, would I pour acid on an open wound on my hand? No. Well, then why am I doing it to my bladder? When you think of it as an injury, you're going to make much better dietary choices. Okay. And again, that's where some of these supplements and some of these other therapies, rescue installations, things like that, you can all read about that over on our website. IC subtype 3 is the biggest subtype, we think, and that is pelvic floor injury. We now think more patients have pelvic floor injury than we do bladder injury. So these are the patients whose symptoms began after a car accident, fall, a rape, having a baby, some sort of pelvic trauma, falling off a horse, right? And your symptoms are still going to be frequency, urgency, pressure, pain, but you're not driven by volume. You're not driven by volume. If you've got a bladder wall injury, any urine in your bladder is going to hurt. So you're going to be focused on getting to the bladder as quickly as you can. So your day is controlled by restroom access. Where with pelvic floor physical therapy, your pain is not as responsive to fluid. It's going to be steadier. It's going to be achier. It's going to have a burning quality to it. You're going to feel, some of you feel a pulling sensation or a pushing sensation. For me, when I have a spasm, it feels like there's a fist up my vagina pulling downwards, grabbing onto my viscera and pulling downwards. Um, but you might have pain with intimacy. You might be somebody who, when you fear going to the gynecologist because whenever they put the speculum in, it hurts. Or if you're somebody who's always had pain with intimacy, that means that your muscles are tight. Your muscles are tight. And the hallmark symptom for men and women is that when you go to pee, you cannot start your stream right away, that you hesitate 5, 10, 15, 20, 30 seconds, a minute, 2 minutes, 3 minutes before you can relax your muscles enough to let your urine out, right? That the hallmark symptom of somebody with pelvic floor dysfunction, tight pelvic floor muscles, is you cannot start your stream right away. Okay, so if you've got those, your therapeutic priority is going to be on calming and soothing your muscles. You got to get your butt into physical therapy. You got to get there. You cannot figure this out on your own. You will never be able to figure this out on your own. Your muscles are too complex. You got muscles that go from left to right, front to back, low to high, and you need a proper pelvic floor assessment to find which muscle group is the problem. Like for me, it's my piriformis on the left side of my body, along with my levator on my left side of my body. And so going and having a proper pelvic floor assessment so they can figure out which muscle group is the issue and then give you the correct exercises and therapy is critical. The reason why Dr. Payne focused on these subtypes and one of the arguments he made in his presentation is it's cruel to tell patients this is incurable when some of these subtypes are curable. Pelvic floor dysfunction is curable, but you have to do the work. And some of you don't want to do the work. And some of you are a little bit passive aggressive. And some of you just simply don't believe your muscles are part of the problem because you're having bladder symptoms, even though the doctor tells you you've got tight muscles. Pelvic floor physical therapy is remarkably successful at reducing pain and discomfort for the bladder, for the bowel, and for the vulva. Okay? IC subtype 4 is pudendal neuralgia. So these are the patients, they don't have a bladder injury, they don't have a muscle injury as much as they have a nerve injury. And so their symptoms tend to be very positional in nature. They're fine when they stand, but when they sit down it hurts, or when they bend over it hurts, or when they squat down it hurts. Or as I learned something very interesting this year. I started having a prickling sensation along my vulva. It made no sense. And they thought it was yeast. Yeast meds didn't work. They thought it was eczema. That didn't work. And the pelvic pain specialist nailed it. She goes, Jill, your muscles are tight again, and they're squeezing the pudendal nerve, and that's giving you that prickling sensation. And she was right. And pelvic floor physical therapy fixed it. And whenever I feel it again, I'm supposed to use my glass wand and work on that muscle, as I did this morning, right? Because I worked out yesterday, so my muscles are tight again. Okay. So in this goal, our therapeutic priority is to calm the nerve down and figure out what's tweaking the nerve in the first place. And most of the time, it's tight pelvic floor muscles. So you're still going to be doing pelvic floor physical therapy. And then the last subtype here is central sensitization. This is my core fundamental subtype. This means that our entire nervous system is sensitive. And in many cases, it's the gift of our ancestry. Hello, redhead, Norway. Okay. Characterized by very sensitive skin. We are drug sensitive. We don't like taking medications because we're so prone to having side effects to medications. We're food sensitive. There are some foods that just don't work in our body, not just our bladder. For me, that's chocolate and oatmeal. I cannot eat oatmeal, destroys me, and chocolate destroys me. Bowel spasms for days if I eat either one of them. We are remarkably chemically sensitive. We smell things that other people cannot smell. We have a wicked sense of smell, and we have a wicked sense of taste. I used to totally freak my last boyfriend out because when he got home from work, I could kiss him and tell him what he ate that day. It was like, that is so weird. It's like, I know, but my sister is an award-winning winemaker. She has exactly the same thing. And one of the reasons why she's so good at making wine is because she's got this extra level of smell and taste that is the gift of central sensitization. And if you go back in time, every tribe needed somebody who had a good sense of taste, good sense of smell to figure out the difference between good water and bad water, good food and bad food. So it's an evolutionary priority. Being sensitive is not a bad thing, it's a good thing. You're going to smell the fire before anybody else. The challenge is being sensitive in 2020 is hard because our daily lives are filled with stress and filled with chemical irritants. And so when you got this subtype, and the odds are if you have this subtype, you're already doing it, you've got to protect your nervous system. We tend to do better in a quieter environment. We tend to do better in the country rather than the city, and we have to take responsibility for making sure that we don't put ourselves repeatedly in positions that will provoke our nervous system. I asked Dr. Ken Peters, who's the top IC researcher in the United States, a few years ago. I said, what do you do when a patient with central sensitization comes into your office? And he, in a joking way, but not so joking way, said, I walk away slowly. And what he meant by that is once I know somebody has central sensitization, I'm backing off on all the aggressive testing. I don't want to do anything that's going to provoke their nerves. My job is to calm and soothe those nerves down. And you fight all the pain generators at the same time. So if you've got, so here are my pain generators. I've got TMJ on this side. I've got tight, painful pelvic floor muscles. And I just went through this crazy period where my nerves, I felt like I had needles in my skin. It's gone now. It lasted about 2 months, and that's what happens if I go through get a lot of bites. My whole nervous system just goes crazy for a couple of weeks or a couple of months. And what he says is, you don't let one keep firing. You treat them all at the same time. Our job is to reduce the volume of the pain, reduce the overall volume of whatever's going on so we can get the entire nervous system to calm down. So if you've got central sensitization, you are an idiot if you're doing caffeine. Because what does caffeine do? It turns nerves on. We want to calm things down. We want to try to do decaf whenever we can. All right. So, based upon uh, now the other thing I want to say about central sensitization is that those nerves can also be sensitized through injury. So, if you were in a car accident, you broke your hip, whatever, nerves can be injured and also develop this lower action potential and become more sensitive. So it might not be genetics, it could simply be injury too. But if somebody told you as a kid, "Oh, Jill, you're just sensitive, get over it." It's really sad that the word sensitive has been weaponized to the degree that it is. You can't get over how your nerves are built. I will never not be sensitive. I am a redhead. It is what it is. Having respect for the way our body is wired is important. Not everybody's wired to be a trial attorney or an orthopedic surgeon. Some people are wired to be writers and artists. And it's about finding a lifestyle and a career that not only you enjoy emotionally, but also physically. When I worked in the city, I was miserable. Work was piece of cake. Could have done the work with my eyes closed. Physically, the drive, the 4-hour commute, the smells, the sounds, the food was too much for me. I was sensory overload. I'm much better in a quieter environment with my central sensitization. Okay. So, and usually people with CSS figure that out very, very quickly. So, based upon that subtyping system, you now then get to ask yourself, where do you think you fit? And then when you're there, you might be like, I'm IC subtype 5, subtype 3. So I'm protecting my nerves and I'm working on my muscles. I don't have to do anything for my bladder right now. You know, you might be Hunner's lesions. If you're Hunner's lesions, you're going to do Hunner's lesion therapy. If you're chemocystitis, you're going to be doing bladder therapies. If you're pelvic floor driven, you're going to be doing muscle therapies. A one treatment fits all approach does not work with this patient population. All right, let's get back to your questions. Carolyn said, what is a good alternative to amitriptyline? You know, that came up in our last support group meeting. I don't really have a good answer for that. My best, so in low doses, an antidepressant helps calm and soothe nerves. And as it calms and soothes nerves, it can reduce pain. It's not a typical pain medicine where if you're in pain, you take more. In fact, patients can overdose on amitriptyline. Generally, when you're taking amitriptyline, you're taking a very, very small dose over time, and you see a gradual reduction and calming of pain and nerves. The only thing that I can compare that to, but again, like Dr. Theo might have a completely different answer for that, would be the PEA. I think the PEA, I can't, it's not an anticholinergic medication. It does not have the same method of action, but I think over the long term, it would have a very, very similar effect. Hi, Kristen. Hi, Sarah. Julie says, is it okay to use a catheter? Um, uh, uh, Presumably, if you know how to use a catheter, that means your doctor has instructed you how to use a catheter. Therefore, you have urinary retention or something else. And learning how to use a catheter is one of the best skills anybody with any sort of urinary issue can have. Because if you ever get in a bind and you can't pee, you can use a catheter. There are risks to using a catheter. Generally, you want to use something called a low fric catheter. Think about it this way: dry skin on dry skin, there's friction there. It hurts. If there's lube, it slides in easy. A hydrophilic catheter is a catheter that hydrophilic means loves water. It basically means it's coated with a jelly so it will slide in and out easily. In contrast to those red rubber catheters, which are torture devices because they're dry. And so if you're going to self-cath, normally you would use a low fric catheter, and usually a pediatric size, a very, very small size to minimize trauma to the urethra. So a 12 French, 14 French, not an 18 French, which would be more an adult size. Slick and small is the goal here. Hi, Debbie. Hi, Heidi. Gigi says, I have a fibroid tumor and it hasn't caused my bladder issues like they originally thought. So, in my humble opinion, before you have your fibroid tumor removed, have them do a laparotomy and look and see if it could be putting pressure on your bladder or not. My gynecologist said mine wasn't. Gigi, excellent advice. Hi, Lisa. Hi, Cindy. Happy holidays to you too. Henriette, Sherry, Kareen, David. Hi, Becky. Gigi, how come those of us with pelvic floor dysfunction are food sensitive? I can explain that exactly. It's called the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? The reality is that they're both involved because they are so intricately connected, but one is normally driving the other. So if you're started with chemotherapy, we know your bladder is screaming because it's in pain from the chemical irritation of the chemo. And because your bladder is screaming, your pelvic floor gets tight to protect you. We call that a guarding. And so obviously anybody with a bladder injury is going to be food sensitive because there's a wound in their bladder that's going to allow urine to get in. But consider the opposite circumstance. If you're somebody whose symptoms began after a muscle trauma, so let's say you had a baby and your muscles are weak. They don't, your muscles don't know they're weak. All they know is they have a job to do, and their job is to hold stuff in place. And so if they're weak, what happens is they overcompensate and become tight. They become tight. What do tight muscles do? Look, if I squeeze my wrist, bam, what happens? You see, it drives all the blood flow away, right? And how many seconds does it take for the skin to get back to normal and for the blood? What is that, 2, 3 seconds? Tight muscles do exactly the same thing to the bladder. Tight muscles restrict blood flow to the bladder. And when you restrict blood flow to the bladder, you're also restricting nourishment to the bladder. You're restricting oxygen to the bladder. And it's very hard for the bladder to be healthy under that circumstance. So the bladder is much more vulnerable when it's not being nourished correctly. And eventually, now you realize you don't know you have a muscle injury. Your first symptoms, frequency, urgency. You call the doctor. The doctor goes, yeah, you must have infection. Give you antibiotics. They don't work. You go back to the doctor. The doctor goes, maybe you got overactive bladder. They give you overactive bladder meds. They don't work. You come back to the doctor. The doctor goes, well, you probably have IC. They give you Almiron. And that doesn't work. And you're struggling with symptoms, symptoms, symptoms. And that is because in this scenario, no bladder therapy is going to fix the underlying problem. The underlying problem is poor circulation from tight blood flow. I mean, from tight muscles. So, the therapeutic priority for the pelvic floor injury patient is to restore blood flow. When we restore blood flow and give the bladder the nourishment it needs, the bladder should heal. And so that is why patients with pelvic floor dysfunction are food sensitive, is because it's very hard for their bladder to be healthy. I hope that makes sense. Cindy says, I have Hunner's lesions. Installations work for you. Installations are going to work because they're going to numb the nerves and calm and soothe that stuff. But fundamentally, Cindy, just so you know, new research from Europe has linked Hunner's lesions to viral infections. So we now know that some patients with lesions actually have Epstein-Barr virus, the same virus as mononucleosis, in their urine, or polyoma BK virus. And HPV and herpes have also been implicated to a lesser extent. And in those studies, they compared patients with lesions with IC patients without lesions, and only the patients with lesions had the viral load in their urine. And so that's a very new and kind of upcoming area. We don't where it's new and emerging research from Europe in the last 3 to 4 years. And so I think what we're going to start seeing too is perhaps some tests with antivirals with patients who have lesions, if they have a next generation test which identifies viral load in their urine. An antiviral makes a bit more sense. Maria says, "What if it hurts while it feels okay for a minute after you pee, but then the pain starts a couple of minutes later, like rebound pain? Is that still bladder wall damage? Probably, yeah, because it only takes a couple minutes for urine to start filling. That first drop of urine to come out of your ureter and start collecting in your bladder again. I got a picture here. Let's see. Hold on a sec. Hold on 1 minute. Let me get a slide. Okay, so let's look at this for a moment. These are pictures of 16 different Hunner's lesion patients. And a Hunner's lesion is characterized by having a very strong red center and then usually with red arms radiating out of it, right? You can see this is like literally the perfect, they call it a stellate appearance. That's what a Hunner's lesion looks like. This is what bladder wall irritation looks like. We would call these petechial hemorrhages or glomurulations. Okay. And so, depending upon how many you have, think about it this way: urine, as urine fills, urine is going into these little mini wounds. It's kind of like a road rash. You know how if you fell and skinned your knee, you'd have a lot of little tiny wounds. That's kind of the way that the bladder wall presents with bladder wall irritation. So as your bladder gets fuller and fuller and fuller and fuller, you feel more and more and more discomfort. And then as soon as you pee, bam, there's no longer urine in those wounds and you feel better. But it's only going to take a couple minutes for urine to come out of the ureter and start dripping down along those wounds again, which is going to hurt again. Make sense? It's fascinating, isn't it? Now, Maria says she just found out she has a mold toxicity too. It's one of my root causes. This is something that came up earlier this year. Oh, what did I do about that? So we had a patient who had severe IC, and they later discovered that her house had a very severe mold problem. That the her hot water heater or something had leaked under the carpet, and underneath the carpet was this massive population of black mold, and everybody got sick in her family. And then she not only got sick, her bladder started screaming, and once she got out of that environment, her bladder did much, much better. And so, yeah, mold toxicity can play a role in this too, for sure. It's a toxin, it's an irritant. Let me look at YouTube here for a minute. All right, I see a reference to the emergency room. So let me check this out. Heidi is asking, did I get her previous question? Heidi, I don't see it. I don't see a question from you before you asking if I got your question. I do see all, guys, it just goes, everything feeds through very quickly. Do not be offended if I don't answer your question. Ask it again. Ask it again, because my feed will, you know, it flies, and I can miss things easily. Please do not take that personally in any way. And of course, you're always welcome to give me a phone call too. You can find the phone number for the IC network right over on our website. Although I'm really not going to be available over the holidays. I mean, I'm going to be here, but I'm not going to be answering the phone religiously because I need a break. We all need a break. But I will be checking my messages. So if something, please leave a message, and if I can call you back, I will. HD Ranch says, Sherry here. I'm in my 6 month of physical therapy for pelvic floor dysfunction. Still get flares from activity. And I'm wondering how many months should I expect before I'm able to resume your normal activities? And it depends upon the type of injury you had, combined with your age. combined with, the expertise of your pelvic floor physical therapist. I mean, guys, I'm older now. It's so weird. In my brain, I'm 25, and yet my body is a menopausal body. It's freaky. But this is what I know, and that is that despite the fact that I feel very young inside, I will tell you from a muscular standpoint, I cannot do what I used to do. My old routine was I would do 100 flights of stairs a day. I would swim a mile or two, and then I would row 5 miles. And I did that 5 days a week for 15 years. I can't do that anymore. And I can't do that anymore because my muscles are older. And that's probably one reason why my pelvic floor got so bad because I overdid it. So as we get older, our muscles change. And as we enter menopause and get through menopause, as our drop of estrogen, our loss of estrogen results in weaker muscles. So I do have to be realistic about what I can or cannot do. I cannot do the workouts that I used to do. And I have to work on different things now, like my core. My core got very weak sitting at a computer all day. And so all of my physical therapy in the last year or two has been focused on improving my core. And it's getting there. But then I didn't do it for 2 months. And now it got weak again. And now I'm hurting again. Passive aggressive? I can be just as passive aggressive as anybody else when it comes to doing the proper muscle work. So anyway, Sherry, I don't know. I don't have an answer for your question. All I know is I would love to be able to do all the exercise I used to be able to do, but physically my muscles are weaker now and I can't. Laura says, "What's good for your stomach? I have a lot of acid, but can't take a lot of things because of my bladder affairs. I only use pre-leaf." Oh, actually, I was just going to say pre-leaf. Do pre-leaf. Pre-leaf is great. Pre-leaf reduces acid level in the stomach and also in the bladder. Thank you, Star Onion. Thank you for your very, very kind words. Cindy says, I've had this since 2010. I had pain so bad I thought I had cancer, just like me. My whole pelvic area was in pain. I started taking Sister Protec and it changed my life. But you still had pain. You started getting instillations of heparin lidocaine. It has really helped. The only pain that bothers me now is in my urethra. And so remember, Cindy, the urethra is often the canary in the coal mine when it comes to estrogen atrophy. And so if you feel like you have a drop of urine stuck in your urethra that won't come out and constant urethral irritation, it could be estrogen atrophy. But I'm really, really glad that you did so well with this Sister Protect. And the fact that, the installations have helped you is great. Now, the question now is, are you using less and less? Are we at a point where you're not needing all of that therapy like you did before? And I hope you are. Healing happens, my friends. Vicky says, I'm a redhead too, always called sensitive. Sometimes I hurt all over. My nerves drive me up the wall. Vicky, man, girl, I got to tell you, for me, it's if I get any bites, though the neuralgia from the bites lasts for weeks or months. And I went through a whole bunch of bites in October and I had trouble sleeping. Like I was using I was using all this skin lidocaine stuff to try to sleep. And finally now, literally in the last week, it's not happening anymore. It's so annoying. I could never live in Florida with all the insects. I need to be insect free or biting insect free. Jennifer says, have you found Elmeron to help with central sensitivity? The only way Elmeron would be beneficial is it would provide an extra layer of coating over the sensitive nerves in your bladder to protect them a little bit more. And so would the supplements would do something similar to that. But it's not going to change the lower action potential on your nerves. We're hardwired that way. Not a disease. Hi, Cher. Samantha says, I'm on 30 milligrams at night of amitriptyline, and my doctor said I could try Cymbalta if the side effects are too much for the amitriptyline. Gabapentin and Lyrica made me super dizzy. So, Samantha, the thing with Cymbalta is that it's known if you find that you like it and you start taking it regularly, getting off of it is a bitch. It's called Cymbalta discontinuation syndrome. It's really hard to get off of. You need to Google that and learn about that more. One for the cause says, can food sensitivity indicate pelvic floor dysfunction? No. What's gonna indicate pelvic floor dysfunction really more than anything else is a pushing, pulling sensation, difficulty starting your urine stream, pain with intimacy. That's really what we're going to look at more for those. Heidi, in the ER, every time I have a hydrodistension within 1 to 2 weeks, but then I'm great until the next hydro. Hydrodistensions are awesome. Well, Heidi, the way hydrodistensions work is that they temporarily kind of break the nerves, so the nerves can't trigger any pain. It's what I call a destructive therapy. It's working by destroying something. You have two different types of therapies. There are constructive therapies, which are therapies which help your body build something important, and destructive therapies, just therapies that kill something. So, like Botox, for example, it's a destructive therapy, temporary destructive therapy because it turns nerves off, but eventually the nerves wake up again. And the same is true, Heidi, with hydrodistension. Although when you stretch the bladder, you're physically breaking nerves, but the nerves heal. And the challenge with that is that sometimes more nerves grow back. And so having hydrodistension over and over and over again, not only are you going through the risk of repeated anesthesia, but you're just breaking it over and over and over. And each time you break it, more nerves have the potential of growing back. I think it's just as important to go back to your doctor and try to focus on cause. What is triggering this in the first place? Getting back to that anatomical mystery. Why are you having symptoms in the first place? Estrogen atrophy? Then we're going to be using some estrogen to give your body what it needs to produce more mucus so that you would not necessarily need to have recurring hydrodistensions. They should be low pressure, short duration hydrodistensions rather than a high pressure, long duration, which is the old way. Gigi says, what about those of us that were diagnosed with a fibroid? I had laparoscopy and they said the fibroid wasn't putting pressure on the bladder, so they didn't remove it. Then there's something else going on, hun. You got to figure out what else could be going on. Could you have a pelvic floor injury? Could something else be going on? Lydia says, if I take PEA, can I stop using amitriptyline? Hun, I'm not a doctor. I cannot ask that question. You need to ask your doctor or your pharmacist about that. Maria says, I miss the info about PEA. Does it help with the pain? The answer is yes. And that was proven in a research study presented in May at the American Urology Association conference. It was a study from Italy that showed that by month 3, 87% of patients had a significant reduction in pain. By month 6, every patient in the study had a significant reduction in their pain, and 25% were pain free. If you Google you know what? If you come over to our website or you go into our store, look for Peora, Peora, which is for sale in our store. And out of the description, cut and paste the word palmitoethanolamide. It's a long word, palmito, PALMITOETHYL, palmitoethyl Alamide, Alamide, but just go cut and paste it from our store and then Google it. Go to the National Library of Medicine, pubmed.gov, and Google it, and you will see all of the research studies that continue to show that various combinations of PEA are successful at reducing pain for a wide variety of pain conditions, including neurologically driven conditions. Kim Colley, is vaginal burning really a symptom of a bladder issue? Vaginal burning can be a sign of estrogen atrophy, but vaginal burning can also be a sign of pelvic floor dysfunction because muscles that are working hard are muscles that build up lactic acid, and that causes a burning sensation. You know, if you were going to go run around the block, your legs would start burning after a certain period of time because you're working them hard. That's muscles producing lactic acid. Your pelvic floor muscles do exactly that same thing. If you work them hard, they build up lactic acid, which causes a burning sensation, usually for women, a vaginal burning sensation. Lydia says, what kind of exercise do you recommend? Lydia, as a matter of fact, I happen to have a video on IC and exercise. If you go over to icnetwork.org and go into our Living with IC videos, have a whole video on what you should be doing. Basically, it's about keeping your hips level rather than doing things that go up and down. So we don't want you on a Stairmaster like I used to do. We don't want you running, jogging with a high up and down motion. It's about keeping your hips level and smooth so that it's not traumatizing your pelvic floor. Walking, elliptical, yoga, rowing, swimming. You want good exercise? Go row. Rowing is not going to hurt your bladder at all, and you will burn calories like you've never burned them before. I would be rowing now, except I've got a freaking pudendal nerve entrapment on my left side from my freaking muscles, and they don't want me sitting on the seat. I would love to be rowing right now. Would get rid of my stomach pudge. Gigi, so I won't have to be on vaginal estrogen for the rest of my life for vaginal atrophy? I don't know what you mean, Gigi. I mean, estrogen atrophy is estrogen atrophy. You're going to have that for the rest of your life, just like I am. I fully intend to be using my topical estrogen for the rest of my life. I know when I don't do it, it hurts. Thank you, Katie. Katie says, thank you for all you do. You have helped me so much with this journey. You are very welcome, and I hope you have a wonderful holiday. Hi, Pam. Hi, Brenda. Vicky says, all of this is expensive. I'm beginning my second year without insurance. Long story. Any suggestions? I'm not making enough to have a tax break. So again, it begins with your subtype, trying to understand what your subtype is. If you appear to be pelvic floor driven, if there's any way you can pay for at least one visit with a pelvic floor physical therapist, if not, just to have a proper assessment and to get the name of the muscle that's a problem, that would be ideal. And then you can go to YouTube and look at a whole bunch of physical therapy videos. If it's levator, you're going to look for levator rehabilitation. If it's piriformis, you're going to look at piriformis, rehabilitation, stuff like that. Of course, we've got some very good books that talk about it on our website and in our store. And if you're a bladder wall patient, then the blessing here is that we have affordable supplements. And so if your budget is, for example, $50 a month, then you might be able to get away with one or two supplements. As an example, Sister Protect was 49.99, and I still don't know what it's going to be now. I've got to look at all the invoices. Some people, instead of taking the full dose, take a half dose to make that bottle last twice as long. So you might need to do something like that, along with making sure you're really pristine with your diet. But at least we have options. Hi, Erin. Erin says, how can I stop a flare after I cycle? I seem to get one every time I'm done with my period. And that's really just your hormones adjusting. You're going to have to ride it out and just try to treat the symptoms. Vicky says, what about sitting cross-legged? Is that a no-no? You have to talk to your physical therapist about what your muscle problem is. It might be okay for some and not for the others. Thank you, Deborah. Thank you, Gigi. Julia says, I'm in the process of getting diagnosed. My doctor wants me to have urodynamic testing. I went to a second doctor and told me there's no point. Any views on that? Urodynamic testing, at least in research studies, has been found to be particularly pointless in the IC patient population. It's not recommended in the AUA guidelines. It's a diagnostic method to be used for IC unless the doctor suspects something else is going on. The point of urodynamic testing is to determine if your nerves are functioning normally. I had urodynamic testing done. Basically, it's done in the doctor's office. You lay on your back, they put a catheter in, they slowly fill your bladder with fluid. And then what they do is they say, tell us when you first feel the sensation to pee. Tell us when you first feel pain. And they're just testing nerve functionality there. It's not the funnest thing in the world, not the worst thing in the world. I think it's very important to have a safe word and really look that doctor in the eye, and if the and say, now listen, doc, if I say the word uncle, you stop. No more pushing, you stop. I am at my limit. Because sometimes doctors can kind of, at least my doctor, when I had it done, when I said, okay, stop, it hurts, the doctor went, well, let me just try a little bit more. And it's like, no, stop, it hurts. So just have that discussion. Just say, okay, when I say this word, I'm not lying. I need you to stop because it's hurting me badly. But so I mean, there's two ways to look at it. I mean, you could go to the National Library of Medicine, which is pubmed.gov, Google urodynamics and IC, and you can see a number of studies that have found it completely pointless, others that might support its use. In the end, it's doctor discretion. And I would just ask the doctor, what kind of valuable data do you think this is going to give you? And how would this change how you treat me? I don't want to say this, but I'm going to say this. It's also a nice way to add a billable to a workup. And mm, some, they've proven that some doctors, not in the IC community, but for some, it's about making money. I mean, if my doctor wanted to do urodynamics tomorrow, I would say no. I would say why? Why? Why do you want to do this? What kind of data do you think this is gonna give you? And more importantly, how would this change how you're treating me? If my doctor wanted to do a cystoscopy tomorrow, I'd say, sure, go for it. I've had a couple. It's no problem. Numb your urethra, stick a scope in, take a look around, pull it out. If that will give them eyeballs on the organ and give them an opportunity to understand your anatomy, then that's better than asking a doctor to guess. I don't like guessing. I don't like guessing. Sometimes you have to let a doctor look to see what's going on. As one patient learned early this year, for years, she wouldn't let a doctor look, and her pain got so bad, she finally did. What did he find? A giant bladder stone floating around in her urine that was cutting her bladder wall. And she wasted years of suffering because of a bladder stone because she was afraid of the test. Once they removed the bladder, broke it up and removed it, guess what? She improved massively. And she probably got the bladder stone because she wasn't drinking enough water while she was traveling. So there comes a time and place when it's okay to let a doctor look. Otherwise, you're expecting them to guess. And frankly, I think you deserve more than a guess. I think you deserve something better than the guess. I think you deserve the facts. And letting somebody take a quick look, as long as you know what they're doing and they're fully informed about it. I'm not talking hydrodistension with cystoscopy. I'm just talking cysto. A cystoscopy is reasonable. And then based upon the cysto, if the doctor goes, you know what, I think I see something funky, if he wants to do a hydrodistension with cystoscopy, that's also justifiable and important. It just needs to be done the right way. And you can read about that over on our website. Low pressure, short duration, not high pressure, long duration. Aaron says, this is exhausting. Oh, I'm sorry, hon. Leanne says, I had a hard month, gone to the ER 3 times this month. Doctor said bladder and kidney infection, gave me antibiotics, helped some, but go back, put me on prednisone, then went back, was in a week with bilateral ovarian cyst. Girl, holy hell. You saw your Medicaid visits this year, ER, where I had to go, listen to videos. Leanne, I hope you're trying. I really hope you're trying one or two of the supplements too, hun. I do. I mean, it would be very interesting to see if the Peora might help some of your pain and discomfort. Somebody said, is Peora the same as PEA? PEA is an ingredient of Peora. Heidi says, you're in the ER every time you have a hydrodistension, 1 to 2 weeks from stress. Dr. Peters said the same thing. He wants me to decrease how many times he takes me to the ER. He does low pressure, short duration. And she says, do you have the guided imagery to listen to for calming music? I think we're completely sold out. It was Dr. Peters' clinic that created the guided imagery videos and the CDs that we had, but they're now free on their website. They're free on their website. You can download them. And I put a link to it in one of our newsletters, and I think I linked to it on our website. The question is, where would I put it? You know what? I bet I put it in I bet I put the link in our store under CDs and DVDs. Oh, I didn't. You know what? I need to find that link, and I will try to post it on our website, okay? Um Hold on. I will try to find that. It's on the Beaumont website somewhere. Here, hold on a sec. Let me. Yeah, just Google it. Google Beaumont Urology Guided Imagery. Oh wait, but they haven't. Wait, they didn't upset. And it looks like they even have a YouTube video of it. Okay, I will try to. I will try to guided imagery audio. Yeah, here it is. Here it is. Here it is. Okay. Let me copy this. I'm going to copy this link and I'm going to put it into Facebook and YouTube. Okay. All right. So everybody, seriously, this is a great resource. And the thing is they've got the research to back it up. Okay, hold on. Okay, so I just put it in on Facebook. Now I'm putting it on YouTube. All right. Aaron says, how do you get people to see past your disease? Girl, holy hell, what a good question. Hmm. It's not about getting people to see past the disease, it's about you seeing past the disease. It's about you understanding very, very clearly that you are not IC. Your life is not defined by IC. Your life is defined by your soul and your spirit and what you do and how you help other people. And IC is one, and the pain is certainly a big part of our lives, but it does not represent me. It does not represent you. I think what represents us far more clearly is the kindness that we show to other people. When I was in my 20s, I was a fairly lost soul. I had no pride in what I even though I'd been to graduate school, even though I even had a presidential fellowship, I was I didn't I hated going to the holiday. I think the problem is that people think as you're growing up that you know what you're supposed to do. And from high school through college through the 20s, there's always this pressure, especially if you're not in a job that you like or a job that people respect. There's always this kind of, well, you're still working at Costco, huh? Kind of approach, or you're still doing this. And I went through a period where I really struggled with the holidays and going to uh, my in-law, my sister's in-laws, because I hated those questions and I didn't know how to answer them. What I knew is that I had not found my purpose. I feel completely comfortable now going anywhere because I've had the gift of 26 years of doing work that helps people, and that has given me uh, uh, comfort like nobody else can give me comfort. And and so I, I see doesn't define me. It's my it has. Oh God, I don't know if I'm answering this question. Anybody else have any insight for Aaron? I don't let anybody minimize me anymore about anything, whether if it's I'm a woman, if it's because I'm a Democrat, if it's because I believe in women's rights, if it's because I've got IC, if it's because I'm willing to speak out about pain and pain management. It's like, hey man, my life, I get to choose what I'm going to do, and this is what I'm going to do. This is important to me personally. And if this is not important to you, power to you. It is important to me, and I'm going to continue to follow my journey, follow my intuition about what I'm supposed to be doing with this in this lifetime at this period of time. So, and I think education is power. I mean, if anybody, I mean, you have to redirect conversations. If people want to dwell on it, if people want to give you uh, unsolicited advice, like drinking the juice of a lemon or cranberry juice, say, listen, I would like to teach you about IC, but not right now. I just want to hang out. Can we just talk about something else? Can we talk about something else? Like, who's been to Star Wars yet? Or are you going to go see Star Wars? Or are you going to wait for a month, go on a Wednesday, matinee, no big crowds, sit on the aisle so that you can run out to the restroom however many times you need to run out to the restroom, which is what my plan is. It's okay to redirect the conversation if anybody's pressuring you. Aaron, I hope that kind of makes sense. That's the hardest question of the day. I mean, will people ever get past looking at me because I have IC? I don't know if I want them to. I don't know if I want them to look past it. It's just part of me. I have sensitive skin. I'm IC subtype 5. Leanne says, try marshmallow root tea or capsules. Marshmallow root works for some people, it bothers other people. Jana says she agrees. Thank you, Becky. Sherry says, holidays are hard on singles. Oh, girl, me too. You know, I'm single. I don't have children. Biggest regret in my life is that I was not able to find the man that was going to be my soulmate. And to go through the holidays single is so hard. That's the hardest part about the holidays for me. I mean, I mean, honestly, I mean, like this year, I mean, when you're the single one in the family, you're pushed aside in favor of the siblings with children, right? And that's understandable. Okay, I don't begrudge them that. I envy them that they get to have wonderful holiday memories with people that they love, that with their lover, with their children and their grandchildren. I don't have children. I had a hysterectomy. I will never have children. I will never have grandchildren. That is a dagger in the heart, honestly. Honestly. And I don't know God's plans. It's it's not what I would have chosen. Somebody when I did last support group meeting, they said, but I sang a little Christmas song to them, and they were like, well, you know, you've got it all. And the answer is, I don't. I don't. You have more than I do because you got children to enjoy for the rest of your life. I don't have that. And that's how Sherry feels. We don't have that. So if you can do anything, if you can do anything this holiday, look for your single friends, make sure they're okay. Make sure they're okay. I'm like kind of so like yesterday, I mean, I've gotten past the point where going to baby showers makes me cry. I don't, I mean, I went through a period of time where I couldn't go to a baby shower. I just, so hard. Or even to some weddings, you know, uh, and I've gotten past that. And now I celebrate with family members and friends the fact that they're having children, right? But it is unfathomable that I will never be a grandmother on Christmas Eve watching my grandchildren open their presents for me like my grandkids did. It's so painful. And so, you find this funny balance. Becky says you can adopt. That's what I plan to do. Yes. And I'm going to wait till I'm older. Yes. And I would like to do that too, but right now I am the mother to two elderly parents, 97 and 90. And so what I right now I'm diverting a lot of those emotions into making the holiday good for them. But when they're gone, it's staggering to me. And I can only pray that God has a plan for me and a plan for you. And that I I just, you know, when I'm out and about, I look for the outcasts because I feel in my heart like an outcast sometimes. Because that's what happened to me when I was younger. Um, and I think you guys know the story where I grew up in a neighborhood where we had a rapist raped and murdered my neighbor and attacked a whole bunch of us, including me. And the kids were afraid to walk with me to school. So for a couple years, there were a group of us who we were so lonely because we were targets, and the other kids tried to protect themselves by not associating with us. And so that forever changed the person that I am today. Forever to go through that, to go through that was just rough. And so now when I'm out and about, and when I go to weddings and when I do stuff, and I look for the outcasts, because they're the ones who need the extra support too. And I love them. I love them. So Becky again, she says you can adopt. That's what I plan to do if I can financially. The thing that stopped me from maybe doing in vitro fertilization and being a single mom was just money. Because by that time I had IC. I didn't work for 5 years. My entire savings was gone, and I just couldn't afford. I couldn't bring a child into the world. I couldn't have paid for in vitro in the first place anyway. Um, you know, uh, I just need to make sure that I can give them a good life, which means I have to do these streams really well and my IC network really well so that I can get paid for that work so I can maybe afford to have the family that I would like to have. I would like to pass my name on. That's the hardest part, is thinking that the hardest part of the hysterectomy is just thinking that I've just stopped my lineage. I like to pass on my red hair. I really would have liked to pass that on. Not the sensitive skin, but the red hair is pretty fun. All right. Jana says, it's a very hard time. My husband passed away a week before Christmas. Most of my friends don't have children. I know he, yeah, yeah. And there's a whole other thing. It's just dealing with grief. I woke up this morning, I've got a 97-year old in the house, just praying to God, please, please don't let anything happen through the holidays. I totally get that. And she says there's always a plan. And I think there is. I really do think that there is a plan. And I really do think that I agreed to that plan before I was even born. And I'm just here doing the best I can, trying to help as many people as I can. I think it's just the only way I can get through it. Hello, Karen. I was talking about the gentleman that I met earlier, who was helping my mother with a medical procedure, and he was stunned. He was absolutely stunned. He's single, and having exactly the same issues that the rest of us had. And we're talking. He's like, "You too? Yeah, yeah." I said, "You're speaking my language." And we were talking about vacations, and he was saying he had gone to Borneo or something like that and had a terrible time because of restroom access. And I was like, I wouldn't have even tried that. Give me an RV. Let me drive through California and up to Washington. That's my perfect dream of a vacation. I have no interest in getting on a plane for a long period of time. All you got to do is tell me I got to get on a plane, and I will be, if I had to get on a plane tomorrow, I would be up all night with IBS and IC just as a stress reaction. Happens every single time. It sucks. But hello, central sensitization. That's the way it manifests for me personally. Cindy says, perfect answer, Jill. We do what we have to do for us. I used to get teased because I didn't go anywhere without my pain meds. Don't give a crap now. I take meds everywhere I go. Just oh, so do I. Believe me, I take a little bit of everything just in case wherever I go. Hi, Shirley. Hi, Victoria. Teresa, it says, how do I help my adult children understand when I'm in another flare and the pain is so unbearable? I have a really good video on about IC flares. You need to explain to them that there are different types of flares, that you have the equivalent of a pelvic injury. So first and foremost, IC is really it's more of injury or trauma than it is disease, unless you have Hunner's lesions. And the reality is that injury can affect nerves, it can affect muscles, it can affect organs. And you can have a bunch of different flares. If you get in a car and drive for a long period of time, you could have your pelvic floor muscles can spasm. If you drink cranberry juice, your bladder wall can start screaming, or orange juice. You are vulnerable. You have an injury, and it is your job on a daily basis to create an environment to support healing. And when you get triggered, you're going to have a flare, and the pain is rough. It's rough. It's agonizing. It can be agonizing. It usually isn't agonizing. What's interesting is back when I started the IC network and I started our support group, I used to ask people, I said, so rate your pain on a scale of 1 to 10. Everybody said 10. Everybody said 10. It's the worst of the worst. And so I changed my definition and I changed the numbers. And this is how I did it. A 1 means you feel nothing and life goes on. You can do everything you need to do. A 2 means you feel a little twinge, but it's not stopping you. You can do everything you need to do. A 3 means, okay, my bladder's twinging. I'm looking for restrooms, but I can still do stuff, but I'm going to be looking at restrooms. A 4 means, okay, my pain is getting to the point where I need to change what I'm doing. I'm going to, rather than being out and about, I'm going to go home and I need to go be closer to a restroom and use a heating pad. A 5 means I am actively using all of my self-help strategies. A 6 means I'm calling my doctor. It means that my pain is intense. I'm starting to get a little scared and I've called my doctor for help. A 7 means I'm at the emergency room. The pain is so intense. An 8 means I've been admitted to the hospital. My pain is so intense. And a 10 means I'm in a coma. It was a scale like that. And in fact, they actually used that scale in a couple of clinical trials, which I thought was pretty damn cool. One I created, right? But when I changed it back into that scale and I asked people to rate their pain, they usually rated a 4 or a 5. That the pain is limiting you. So is the pain limiting you, but can you still go out and do what you need to do? Or is the pain so bad that you need to come home now and be close to a restroom and use your pain medicine? That's just a key descriptor there. And also, Teresa, you should show. I filmed a video. I have a really good video, I think from before Thanksgiving, where I actually am talking to family members who don't believe. One of the live streams, and so you could actually show them a video, sit them down. Thank you, Cindy. Leanne, you guys, you're being so nice about being the single and not having children and stuff like that. And Leanne points out that sometimes I love being single, but sometimes it's hard for me, even Valentine's Day. And I broke up with a guy I thought I was going to marry on Valentine's Day. Didn't see that one. No, I have to take that back. I did see that one coming. I just didn't think he would be so tacky as to do it on Valentine's Day. Being single is weird. You got to have your circle of friends. But you also, I mean, I think the other thing too is like yesterday, as I was doing my thing, I had to go. So I went to the gym, did a little bit of shopping for my last bit. I went to one store, J. Jill, to get a couple of presents for 2 people. Then it was done. And all day I was just thinking, you know what I want to do today? I just want to light a fire in the fireplace and I want to read a book. And I made dinner for the folks. And after that, that's what I did. And I loved it. That was so comforting to me to just be able to sit there. I was reading a Mercedes Lackey book, fantasy book about Mags and his family. And it was just perfect. And that's what I'm going to do tonight, too. Nice quiet time. Hey, you guys, just out of curiosity. Hey, man, listen, since we're all in here, I would love to know what is I want you to answer two questions for me. Number one, what is your favorite icy friendly holiday food? And number two, what is your favorite holiday music? So, can you put down what is your favorite holiday bladder friendly food? And also, what is your favorite holiday music? For me, my favorite holiday music is the John Denver Christmas thing that he did years ago, TV show. I love John Denver and the Muppets on Christmas. Makes me smile every time. Sherry says, "How many are on buprenorphine now?" I have no idea. We haven't asked. Thank you, Jana. Tabitha says her favorite holiday thing is peanut butter fudge. Girl, you got that right. There's nothing in that that's going to hurt your bladder. And Sherry likes Andy Williams. Oh, I love Amy Grant. I love Amy Grant. She's wonderful. Thank you, Jana. You're very welcome, SC. I really hope that I've been able to help, and I hope you're doing better. Hello, Curtis. Sharon likes the Osmond family songs. Okay, I haven't heard those in for years. Suzanne says, "How can I know the difference between IC or a bladder infection?" Well, number one, IC does not cause fevers, where an infection will. But number two, bladder infections are really notorious for causing really bad urethral pain, burning when you're peeing. And IC normally doesn't do that. A bladder wall injury does not normally cause urethral burning, but estrogen atrophy can also cause urethral burning. So the big thing is, how does your urethra feel? And number two, are you presenting with any infection? I mean, any fever? Tabitha likes Mary. Did you know? That's a lovely song. Lydia says, old fashioned Christmas music. You know what? Burl Ives. Have a holly jolly Christmas, right? The old Burl Ives songs from Rudolph the Red-Nosed Reindeer. Josh Groban, yeah. Sarah McLachlan, yeah. I like Celtic Women, and I love the song Christmas Pipes. I like the Celtic stuff a little bit more. All right, my friend. Well, it's a Sunday before Christmas. So I'm going to give you some homework. It's time for your holiday pep talk, right? So this is what I want you to do every day, all the way through New Year's. Number one, every day, 15 minutes, do something that will bring you peace and comfort and joy, something that will reduce the stress level. So for me, it's going to be sitting in front of the fire with a book or going and taking a walk. Um, this is the time, if you've got family members and friends, reach out to them. If they can't be with you, talk with them on the phone. Tell them that you love them. It isn't about your IC, it's about the holidays. And so give them kindness, give them compassion, give them love, role model them the type of behavior you would like to get, right? I need you to do 15 minutes for your bladder. I need you to do so. If you listen, what did I say when we started this? Do not break your diet on Christmas Eve and ruin your Christmas day. You got to behave on Christmas Eve and eat the right foods if you can. Luckily, the vast majority of of holiday foods are IC friendly, whether it's matzo ball soup or turkey and gravy, or even ham or crab. IC friendly. It's what you put on top of them that can be the issue. And even the same is true with the desserts. And breakfast. Like we're going to have eggs Benedict for Christmas morning, or you can have thin pancakes for breakfast in the morning, or waffles or something like that. Those are all going to be pretty IC friendly. So from a diet standpoint, really the only thing that's going to mess you up is going to be Italian food, uh, or alcohol. And if you're going to drink alcohol, if you're going to drink wine, go for a low acid alcohol, which is going to be a Merlot or a Chardonnay. Put ice in it, put water in it, sparkling water in it, dilute it as much as you can, sip it. Sip little mouthfuls. You might be able to get away with that. You might be able to get away with that. If not, just go straight for the sparkling water. Or or if you like something warm, heat up some eggnog and put some cinnamon or nutmeg on it, and that should be IC friendly too, as long as you don't put whiskey in it. Um, I need you to do 15 minutes for let's see, hold on a second. So we got your bladder, we've got your spirit and your soul. And you know what? I'm giving you time off for knowledge. You don't have to read anything about IC for the next 2 weeks. Take a break. Take a break. Don't read anything. And that means, you know what? Get off your support groups too. Do not spend hours and hours on Facebook support groups or IC network support groups and read negative stuff. Come on, it's the holidays. Open up the windows. If there's snow outside, go make a snowman. Hit somebody with a snowball. Make some cookies. That's your homework. Right now, you've got time. Go make a batch of sugar cookies, huh? Those aren't going to hurt you at all. Commit a random act of kindness for your family and bomb them with cookies. I truly, truly hope that you have the best holiday you can. If you're having a flare, it's not your fault. It is what it is. You've got to put yourself first. If you need to stay home, it's okay to stay home. I've been talking about this every week for the last couple of weeks. I have got some really good videos over on our website on if this is your first holiday with IC, traveling with IC, how to make things more comfortable for you. Go watch those videos. I think that you will find those helpful too. All right, my friends. All right, listen, I'm going to see you on the other side, hopefully next Sunday before New Year's, and we'll talk New Year's resolutions and any new information. I wish you the best. And hey, listen, there's still time for Christmas cards. If anybody loves to exchange Christmas cards like I do, you can come on over to our website, get our P.O. box, and I will send you a Christmas card back because I love getting Christmas cards and I love sending them back out. All right, my friends, big hug from me. You're not alone. And let me just say one thing. When I took an anxiety management class, one of the things that they taught us to do is if you're walking into a situation where you're really not sure how to handle it, pretend you're someone else. What they say is pick a role model, pick somebody you admire, pick somebody that you know handles situations well, and walk in and channel them. And so when I went through the class, I channeled Shirley MacLaine. I really like Shirley MacLaine because she's a redhead and she kicks butt. And I needed to learn how to do that. I'm pretty good at that because of that. So if you're walking into a situation where you think people are going to be tough on you, I want you to pretend that I'm standing right next to you. And I've got my arm around your shoulders and I've got your back. And always, always, always remember that you have millions of brothers and sisters with IC. I'm one of them. We stand behind you, we stand with you, we stand for you, and we are together. You are not alone in this. I'm not alone in this. There is strength in our numbers. All right. Merry Christmas, everybody. Happy Hanukkah. And I wish you a beautiful couple of days. Do a lot of deep breathing if you need to. You'll get through it. We'll all get through it together, right? Okay, guys. See you later. Bye, Alan. Thank you. Karen, go to our website, check the diet. I'll bet you'll find something. Turkey, mashed potatoes, carrots. You should be able to eat those. Leanne likes Dolly Parton's Hard Candy Christmas. I like those too. All right, guys. See you later. Donna S., what do I think of bladder removal? I'm ready to pursue this after 5 years of illness. Number one, bladder removal is only considered if you've done everything else. And by the way, I've shut down Facebook, so I'm only talking to YouTube right now. So bladder removal is in step 6 of the AUA 6-step treatment protocol for IC. So I want to make sure that you've done everything else before you've gotten to that point. Number 2, we need to make sure you've been subtyped correctly and we know what we're dealing with. Remember, Donna, I was telling the story of a patient a couple hours ago when we started this, who for 30 years tried bladder therapies. Nothing worked. Nothing worked for her. She's having very dark thoughts, very difficult time, just like you. But then I said during a meeting, you are an anatomical mystery to be solved. And she decided to ask for an MRI. And you know what they found? Was that she had a big bunch of scar tissue embedded in her pelvic floor muscles that was triggering all of her pain. And it turns out she was a big horseback rider when she was younger and had a number of mega falls off the horse. And so clearly she was a patient who, 30 years of wasted time doing bladder therapies, none of which worked, because underneath it all, it was never her bladder, it was her pelvic floor. And so, Donna, what I would say to you is, again, when you go to a doctor, you are an anatomical mystery to be solved. You never, ever, ever walk in and say, I've got IC. You have to talk about your symptoms. You have to discuss your symptoms in depth. Doctor, why do I have a pain on the left side when I bend in a certain direction? Doctor, why do I feel a fluttering? Doctor, why is sex painful? Doctor, you is it internal? Is it external? Is it high? Is it low? Is it to the left? Is it to the right? And since you're at the and hon, I was there my first year. I begged him to take my bladder out. It's like, please get rid of this. And my urologist said, no, we haven't done enough for you. You haven't even tried anything yet. So, and he was right. And you know what? 20 years later, I'm symptom free. Thank God we didn't take my bladder out. I wasn't patient. I was suffering, and you're suffering. So we got to dot our I's and cross our T's here. We got to rule out all of those other conditions. Let's make sure they haven't missed anything. Let's make sure that you've done reasonable therapies based upon your subtype and so forth. So, Donna, my Christmas gift to you is I would absolutely love to give you a wellness coaching session sometime this week or next week. And let's go through it all and let's see if we can figure something out. The way we can do that is here, hold on a sec. Is if you go over to actually my email address, icnetwork@mac.com. icnetwork@mac, M as in Mary, A as in Apple, C as in Charlie.com. Send me an email and I will try to call you when I can. Okay. Let's do that. I bet we can at least try to understand why your bladder, give you at least more things to explore to try to understand why you're not responding to therapy. And it's going to start with subtyping. So let's see if we can try to subtype you, okay? So IC Network at Mac, like Macintosh computer, IC Network at Mac.com. And any of you watching this, feel free to email me. It's okay. And I will do my best to try to give you a phone call sometime this week, okay? And who knows? Who knows? Might be tomorrow. Okay, you good? icnetwork at mac.com. All right, everybody, I wish you well. Happy holidays.